As we come to the end of another busy month here at the Trust, I'm pleased to bring you a roundup of stories from throughout July. We started the month with a look at our estates and facilities team and the work that they do behind the scenes to ensure our sites can function and our clinicians can provide care to our patients. Here's Neil Harvey, Head of Estates Maintenance, to tell us about the crucial work that the team do here at the Trust.
We deliver a 24/7 service. It's very much back of house staff that get unnoticed and unrecognised, but they're fundamentally the core backbone of the service. Estates, we have maintenance workers, maintenance assistants, grounds and gardens teams, painters and decorators, joiners, going into the capital team, covering all aspects of the construction design and management regulations. Then all the way through to the business management team, they focus around policies and procedures.
Facilities covers a wide range of areas. You've got the cleaning team, you've got the porters, you've got the catering and ward hospitality staff, you've got things such as even linen and accommodation staff, which is all covered by facilities.
Being local, you feel like you can interact with them better, give them a better experience, but also you don't want to feel like you're in their way. If we do our job correctly and we can do it to a good quality standard within the time frame, it makes their time here better, and it also makes our time better as well, because we know that we're helping vulnerable people.
Thank you, Neil, and all our estates and facilities colleagues. We also had the opportunity this month to meet Paul Street, Falls Prevention Lead, to hear about what we've been doing here at the Trust to assess some of the issues that cause falls and what we've done to decrease them.
One of the ways we can reduce falls is if we implemented bay tagging, which is when a member of staff is in a bay looking after 4 people to keep them as safe as possible. It's looking at training and education for staff.
So, falls intervention. In Bradford, we used a yellow wristband. So the yellow wristbands are put on someone if they're a falls risk.
It's about looking at putting in things to prevent them from happening in the future.
We proactively risk assess daily. Pre-COVID, we were having consistently 15 falls a month. I think one month we had 29 falls. Since implementing the changes, we have on average around 5 a month. It's improved the relationship and the trust between staff and relatives.
Thank you, Paul. For the podcast this month, we heard all about the Magnet for Europe programme, a significant initiative that's transforming nursing practice and improving the experience for staff and patients here in Bradford. I had the pleasure of sitting down with Sally Scales, Director of Nursing and Programme Lead for Magnet, and Amy Hunter, Lead for Nursing Excellence and Professional Nursing Advocates, who have been at the forefront of this initiative.
There's a real principle around we shouldn't be making decisions at a senior level that influence the care that happens on the ward. And one of the real components of Magnet is this concept of shared governance. And that isn't about, just being top down or just being bottom up. It's about us creating the structure and the culture in the organisation so that when something needs to change or somebody identifies a need for change in a department or a ward, that the right people are involved. The people who are giving the care have the opportunity to get involved.
You can hear the full episode of my chat with Sally and Amy by subscribing to the podcast. It's available in all major podcast providers. Simply search Let's Talk with Mel Pickup. Finally, here's a look at some other exciting things that have been happening around the Trust this month. Well, that's it for this month's update. I look forward to sharing more stories with you next month. Don't forget, all our latest news and updates can be found on our social media channels, X, formerly Twitter, LinkedIn and Facebook.